Hello, good afternoon, and thank you for joining us today on the program Healthy Living. I'm Adesuwa Osa here. Today on Healthy Living, we want to look at constipation. Do you know what constipation really is? Or you just follow the bandwagon to say, oh, I have constipation, go and take this, go and take that. Is it life-threatening? We're talking about constipation now. Does it get to a point where someone's life someone's life will be in danger as a result of constipation? What is the importance of bowel movement? There are some persons who cannot move their bowel successfully without using drugs. It is like that for some persons. And why is it that for some others, they are always suffering from constipation, no matter what they do? Does it have to do with the food they eat? Does it have to do with intake of water? What has constipation got to do with your health? Does underlying ailment and other medical factors responsible for constipation or what? This and many more is what Dr. Jolly Nosa Iguma is going to be answering today. Is the medical director of Jono's Medical Center here in Benin City. In fact, it is in the heart of Benin City. And Dr. Jolly Iguma is a friend on the program. He's always here when we call him. So, Doctor, it's been a while, and happy to have you join us today.
It's a pleasure. Good afternoon, viewers.
Okay. So, Doctor, we're looking at constipation. What is constipation? What are the signs and symptoms of constipation? So, it's like two questions in one already.
Yes. Constipation, by definition, is the infrequent passage of hard stool. Is a problem that everybody in their lifetime will certainly experience or will have experienced in the past. Okay. Every man must eat to survive. You need food that will keep you living, and the food that you eat through your mouth must be digested, after which it must be excreted. Digestion generally begins from the mouth. Whatever you eat, the digestion starts from the mouth. And from the mouth, it goes to the esophagus, down to the small intestine, which is the duodenum, the first part, the jejunum, the ileum, after which it goes into the large intestine. So what I'm trying to say here is that any food you eat must be digested before you have the room to absorb in or take in another one.
Okay.
When there is a problem in a compartment, one of the compartments in the intestinal tract, I've mentioned the mouth, I've mentioned the esophagus, I've mentioned the stomach, I've mentioned the small intestine. Of course, constipation will not occur when there's a problem in any of these I've mentioned. Constipation is a problem with the large intestine.
The large intestine.
Yes.
Okay.
Food that one has eaten stays up to 30 minutes, 45 minutes in the stomach, after which it empties its content. After 4 hours maximum, the stomach will empty its contents down to the small intestine. And for the small intestine, after maximum an hour, the small intestine will now take its partially digested foods down to the large intestine. The purpose of the large intestine now, which is divided into 4, like we have the ascending column, we have the transverse column, we have the descending colon, we have the sigmoid colon. So if any of these compartments has a problem, or has an ability to retain food for a longer time, that person will be prone to constipation. That is to say that the maximum time the food is allowed to stay in the large intestine is 36 to 48 hours. But to 48 hours. That is when the food is expected to stay. The partially digested food is expected to stay in the large intestine. But for some persons, you can see that their large intestine will retain this food for up to 144 hours, which is 3 to 4 days, even up to like a week. In that case, if there's a possibility for this person to now go to toilet or there's a defecation reflex, there will be problem with passes too. Or most likely this person will now have difficulty in passes too freely or pass what we call hard pellets too. So in other words, we can say that constipation occurs when there's a problem with the large intestine. The part of the digestive tract where that is responsible for this constipation is the large intestine. And as I said earlier, in one lifetime, one will have experienced constipation. But the problem now is some persons are prone to suffer constipation than others because of some certain reasons, which we are going to look into.
Definitely, we're going to ask you that. So, a lot of persons do not know when they are suffering from constipation, okay? So, can you please tell us the signs and symptoms, apart from hard stool and all of that? What are the things we should look out for, or how is one supposed to feel when one is suffering constipation?
Yes, by definition, as I said earlier on, is the infrequent passage of stool. When you have...
sorry, Doc, there are some persons, at least I know one or two, who do not use, who do not, have a bowel movement all the time, okay? That's just their nature. Or would you say such a person is suffering from constipation?
Yes. By the time we look at the causes of constipation, you will understand the different kind of constipation. Like as I said earlier on, you can see that whatever food you eat, maximum 48 hours, the food is supposed to go out. Because the lower part of the digestive tract, which is the large intestine, where there's absorption of water from the partially digested food, food is not supposed to stay longer than 36 to 48 hours. But for some persons, they retain this food longer than that. Such person is bound to come down with constipation. And there are reasons for such condition. So for the symptoms, or for one to know that he or she suffers constipation, the symptoms are, you have the urge, there's a defecation reflex. That is to say that you now have the call of nature to say you want to go to toilet, but you are there. You find it difficult, you are straining, you are now exerting more energy to pull out the feces down. So that's a frequent passage of stool. The straining, you strain, and there might be also perianal discomfort. That is, you have discomfort within the perianal region. Even sometimes you experience, abdominal discomfort. And most often than not, the person will have cessation of complete evacuation. That's to say that you feel something is still there. It's not coming out. You feel like this thing have to come out, but it will not come out. So when you have these symptoms altogether, the stool coming out is hard, there's straining, there is cessation of incomplete evacuation, there's a discomfort within the perineal region or the abdominal region, as the case may be. All these are symptoms of constipation. Like as I said earlier on, some persons are more likely to be constipated than others.
Okay, now let's look at children, because often the time we hear mothers say, particularly infants of between, say, 0 to like a year, thereabouts, or up to 5, you hear parents, even without going to the hospital, say, this child is suffering from constipation. Let me do this, let me do that, let me do that. You find it difficult to comprehend why a mother will just think that the child has constipation. So when a child is having constipation, what should we look at in that child?
Yes, the child is like, would be seen like a small adult in any way. And considering the causes of constipation in children, we can look at gastrointestinal cause.
Okay.
What it means is that, just like as I've highlighted earlier on, the intestinal tract, the colon, which is the large intestine, where there is supposed to be an absorption, or where there's an absorption of fluid in the partially digested foods, after which it becomes stool that one will go and pass out. So when there is a dietary cause, in intestinal cause now, like we can look at it in two forms, gastrointestinal and not gastrointestinal cause. What it means is that it is not when you have a problem within the gastrointestinal tract that you can be constipated. There are other medical conditions that one will suffer that will make that person to suffer constipation. But however, the gastrointestinal causes include dietary. The food that you eat will determine whether you will be constipated or not. If you have inadequate fluid intake or fiber intake, you are more likely going to be constipated. Like the children you just spoke about, you see, children are fed mainly with milk formulated, either breast milk or artificial. So those milk might not have enough water in them, as the case may be. So children can because when we are talking about when we are talking about exclusive breastfeeding, we advise mother not to give water, but give enough breast milk in any way. Except maybe you are talking about predominant, with which you give water, you know, alongside with the breast milk. But in that case, we are no more doing exclusive breast feeding, as the case may be. So when there is inadequate water intake, like the children, of course, children are not fed with vegetable. Babies are not fed with vegetable because even when you are to wean them, you don't normally start with giving them vegetable most at times. But you see that the diet is usually breast formulated. So because of that, because there is inadequate fiber, which is vegetable, which is fruit, and other fiber formulated, as the case may be, because this is inadequate in their food, in children, they are most likely going to come down with constipation. In general, when we're talking about the dietary cause of constipation, if as an individual you take little or no water, you will have little or no fiber in your diet, such persons will most likely come down with constipation. Other than that, we also have what we call structural problem. Some persons, they have what we call diverticulum. It's a problem within the gastrointestinal tract, or a diverticulum disease. There is a kind of a swelling within their, colon. As I told you,
is that swelling painful?
Sometimes, if it's infected, it could be painful. It becomes diverticulitis. It is not a normal, the normal colon has a ostration, but when you now have a kind of a balloon-like structure within the colon, it becomes a diverticulum, which is an abnormal structure within the colon now. So if that colon now is there, food might escape it there, therefore blocking further movement of food. Because there's supposed to be a motility within the colon. There's supposed to be a movement, a kind of. So that diverticulum will block further. We kind of distort the motility. So when there's a structural problem, like somebody that has diverticulitis, or somebody has colonic cancer, they are most likely going to come down with constipation. So even in children, they what we call Hirschsprung disease. In that case, it occurs in children during their neonatal age. There is loss of nerves within the lower part of the large intestine. There's no innervation in that place. We call it a ganglionic nerve fiber, which are absent within the lower colon. So in that case, such babies will come down with constipation. It is common. We call it Hirschsprung disease. In that case, you will see that within the first 1 week, within the first 1 month of birth, the mother will tell you that anytime the baby wants to strain, the baby wants to stool, the baby tends to strain. There's difficulty in passage of stool. And most often, they will end up with operation. Or we give them what we call stool softener, or a form of a laxative that will help to, soften the stool, depending on the degree of the Hirschsprung disease in children.
Talking about laxative, now, there are some persons who cannot move bowels except they take laxative. What kind of condition is that? They just have to. And some usually on self-medication. without consultation with the doctors or professionals in charge. You just see somebody who is constantly on laxative, particularly herbal laxative, that, oh, I need this to, you know, move bowels properly and all of that. Well, what could be wrong with such a person?
Yes, knowing the cause of the constipation will be a pointer towards how we can be able to treat the constipation. Some persons use laxative irrationally. There's supposed to be what we call rational use of laxative.
So it's been abused.
They abuse it. And when they abuse this laxative, of course, it will treat the constipation for a while. When there's no rational use of the laxative, what the person will express is what we call reactive diarrhea. Okay. Because the laxative, what it does, whether the osmotic laxative, whether the stool softener, whether the fiber type, what it does is that it helps to increase the motility within the colon. Because when there's a slow movement of the partially digested food within the large intestine, as I've said earlier on, such person is going to come down with constipation. But the mechanism of action is that the laxative tend to reduce the rate with which the colon absorb water from the stool.
Okay.
If not, you can say that when you go to toilet, what you will experience is just water loss. But the colon, the large intestine, reduce or help to regulate the amount of water that will be in the stool. So when you take laxative irrationally, it could even aggravate the constipation. Of course, there's going to be a reactive diarrhea. Okay. After reactive diarrhea, you go back to the constipation. Because it's good for you to see a doctor so that the doctor will know the cause of your constipation. Okay. Like as I said earlier on, constipation could be simple constipation. The simple constipation is just the ordinary constipation that anybody can just experience, maybe because of your poor diet.
What's the duration of that? Does it stay long?
Maybe 48 to 72 hours, as the case may be. And it comes once in a while. But when it becomes persistent, like what we call idiopathic severe constipation, such person might even end up in an hospital with what we call the soap and water enema. We have to wash. Exactly. Okay. And maybe the person might even go in using the herbal laxative to flush, which of course might be even dangerous to the kidney, to the liver.
Is it good for somebody to practice enema alone? You know, you just self-medicate. You just do it by yourself, because I've heard somebody do that to her kids.
Yes. It's a simple procedure. Because it's not an invasive process, because you are not going to go through the vein or maybe penetrate any vessels of the person in question. It's just a specialized container with a pipe, and you just put in the rectum. You just let the soap water to go in there as a way to, soften it, to increase the viscosity, just to allow the stool to become, that is hard now, to be able to get wet, and there will be free movement down as a way of reducing the constipation. If the mother or the caregiver of the person that is constipated is well trained, of course it's a procedure that one can be able to carry out.
How often can that be done? Because some persons just do it continuously. How often can that be done?
Of course, when it becomes a continuous thing, there's a need for you to see a doctor. Okay. Because constipation does not just occur. There is a primary cause with which the constipation becomes secondary to the primary cause of the constipation. Like as I was trying to itemize earlier, that there's a gastrointestinal causes of constipation. Like I've said something about the dietary cause. I've said something about the structural causes, like the Hirschsprung disease in babies, like colonic cancer in adults, like diverticulum. Then we also have what we call the motility. In motility, as I said earlier on, you see that there is a movement within the colon, and the shorter the partially digested food stays in the large intestine, the shorter it stays, the more likely person is going to have diarrhea. the longer it stays, the person will have constipation. It's a two-way thing. That is why people say that when you take in food, maybe after some minutes or less than an hour, you have this kind of abdominal discomfort.
Yeah.
Before you know, you start running to the toilet. You see that the colon have been distorted. In that case, maybe as a result of food poisoning or as a result of diarrhea. So what the colon does, the large intestine does, is to help to absorb absorb water from the partially digested food. So when the partially digested food stays longer in the large intestine, you see that the large intestine will now perform more work by continuously absorbing water because the partially digested food is there, is staying longer at this point in time. So in that case, you will see that when the person is about to pass out stool, you might even pass out a rocky, very hard stool that might even cause tear or injury to the exactly. So you see that when there's a problem with motility, maybe like somebody that has what we call the irritable bowel syndrome, or somebody that has what we call the slow transition constipation. In that case, they have this tendency for their colon or the large intestine to retain, to seize.
So how is all of this diagnosed? Can somebody just self-diagnose and say, okay, oh, this is the condition I'm going through? Or must you see a doctor?
Yes, when you see a doctor, we can do some invasive or non-invasive investigation. And the history is very important too. And we should not also forget that other than constipation, of course, is very common and is very worrisome. And some persons will keep the secret to themselves and going about abusing laxative. And the laxative that is mostly abused is the herbal formulated type that will cause reactive diarrhea. You take them, you start having diarrhea, and most of those herbal formulated are even purgative, that you don't even know the makeup of that. The makeup of it and the dose required. They will tell you just drink the bottle, take this powder, put in water, just drink. Eventually, the person might even end up with kidney or liver problem, as the case may be. And why would this person be taking that risk, absorbing such medication? It's just because of the fact that they want to treat their constipation. Because constipation is worrisome. Well, it causes discomfort.
A lot of persons don't say constipation as something serious. So is it life-threatening? Is it serious? Is this something that we really have to work on by going to see a doctor?
I tell you that.
But we just say ordinary constipation and it ends there.
Okay. It's my interest everyone to know that every woman will certainly experience pain during childbirth. Though there are artificial means with which you can be able to reduce labor pain. But I'm talking about natural labor pain. When a man that will never be in labor at any point in time wants to mimic labor pain. For a man, not a woman now, for a man that has if a man wants to mimic the pain of labor pain, let them suffer constipation. You can see yourself even moving around in the toilet. You sit down, you stand up. You sit down, you stand up. You sit down, you stand up. You are having beer down, but the thing is not coming out. You cannot be able to pass out too. It's a problem, and I tell you that some constipation have even resulted to intestinal obstruction that will even result to surgical recession. That is to tell you how severe some constipation could be. It's life-threatening, certainly. And as I said earlier on, you get to understand that constipation is also a end result to some medical condition other than the gastrointestinal.
Okay, I'm very interested in that, and I know that a lot of persons will want to know if constipation can cause internal damage or any other health problem, just as you mentioned before. And if yes, please just table it one after the other so that our viewers will get to know that constipation is serious health business.
When anyone suffers constipation, they are more likely going to come down with a ureter disease. A ureter disease has to do with any medical condition that is occurring within the anus and the rectum. Because these are the parts that are responsible for the defecation. Because there is a reflex there. There's what we call the pubo rectalis. There's what we call the anal sphincter that must be relaxed through a signal that is sent by the brain down there to say, okay, the urge to answer the call of nature. Okay, let me go to the toilet, and you are able to empty your bowel freely. A situation whereby you are now having difficulty, you are now straining, you are now pushing to the end.
Even singing and dancing sometimes.
Exactly. You see that such persons are prone to ureter condition, like your hemorrhoids. Hemorrhoids is very common to those who suffer constipation. Not only that, there's what we call anal fissure, which is a tear within the ureter region. I told you about that. I told you about the fecal material, that the longer it stays in the large intestine or the colon, the more likely this person is going to pass a very hard stool that can even sound, you know, like a bomb in the septic tank. If that has to is to pass through the inner region, it's most likely going to cause a tear there. And that tear will not further cause pain. Even when the patient is not trying to stool now, there will not be injury in that region. We'll not call it anal fissure. It's a very painful condition. It's one of the most painful anal condition. Even when the person is sitting down, is having pain. And the person will tell you that this pain started when I forced myself to pass out a hard stool. And when we view and when we examine the anal region of the person in question, we cannot give a diagnosis of the anal fissure.
Does it have a relationship with pile?
The pile is just a protraction. It's just the veins descending downwards. So that is why I said earlier on that people that suffer constipation are most likely going to come down with hemorrhoids or pile as compared to the general group. Anal fissure is different. Anal fissure is just a tear within the region there, whereas the pile is just dilatation of the veins. You see protrusion, or maybe you feel pain, or you feel itching, or you feel blood coming out from there, depending on the stage of the pile or the hemorrhoid, whether first degree, second degree, third degree, as the case may be. And not only that, Crohn's disease too. All these are conditions with which somebody that suffers constipation will come down with. And funny enough, those ureter conditions also exacerbate the constipation. Somebody that has constipation will cause any of these ureter condition, and the ureter condition will now further exacerbate the constipation. For example, somebody that is able to strain with enough energy to pass us to, yes, once he or she now has a tear there, there will not be discomfort, of course, to pass us to. Once he or she now has a protrusion as a result of the pile, there will be discomfort to pass us to. When there's a Crohn's disease there will be problem to pass to. So you can see that a ureter condition aggravates constipation. Constipation also aggravates a ureter condition.
Right. I know that at this point you may want to put a call across to Dr. Nosajoli Guma of Jonas Medical Center here in Benin City. If you want to do that, the phone number will appear on your screen shortly. It's 052-290-573. 052-290-573. You need to make that call now because, like Dr. Jolly said, most often the time you suffer constipation without even knowing. And constipation can actually cause other health problems for you. Now, doctor, let's look at somebody who is always complaining of, you know, there are some persons, no matter how little they eat, they feel bloated. You know, they can't eat much, yet they feel bloated, you know, and then they feel it, they are so uncomfortable. You know, and then when you touch the stomach area, it sounds like a drum. You know, you hear this ta-ta-ta sound, you know. It's kind of, and usually the stomach will be very tight. You know, what can such a person do?
Yes.
Can that person go for surgery?
Not,
Is there a health issue with that person or something, you know?
Yes, that actually is flatulence, and is also a problem with the colon or the large intestine. When there is fecal impulsion, what it means is that if any of the large intestine, whether the ascending colon, the transverse colon, the descending colon, and the sigmoid colon, even the rectum is impacted, as in there's a stool that is blocking any of this area. It therefore means that the proximal part, or before the area where the blockage is stool that is causing it now. And it's also a follow-up to constipation in any way. So in that case, there will not be build-up of gas. That person will not suffer, will not, you know, you feel that sound, that percussion sound of, you know, you feel the person like a bound, you know. In that case, there is a need for that person to regulate his or her diet. Okay. Take fiber. Okay. Take a lot of water. And if possible, the person will also be advised for a rational use of laxative.
Should that person be scared? Can we say is a cancer scare? Because there was somebody who couldn't do all of this and the person was like, maybe it's cancer. You know, when people start to talk.
Yes. And we should not also forget that I did say that there are conditions that will make somebody to be prone to constipation. And I classified that as structural problem within the gastrointestinal tract. That was when I talked about diverticulum. Yes. I talked about colonic cancer and the Hirschsprung disease in children. Of course, when there is a cancer within the large intestine, because you see, I've tried as much as possible to explain that constipation is a problem in the intestinal tract, and the part of the intestine that is involved is the large intestine, which is the colon. So when a cancer is affecting that area, partially or totally, the person will come down with constipation, because the motility now is already be tampered with. So I would not be surprised when you say that somebody once had that problem and the person was not diagnosed.
But unfortunately, people don't go to hospital. We have bad attitude, very poor attitude.
You know, in this part of our environment, yes, in this part of our environment, in this part of the world, it's a God forbid thing for one to go to an hospital.
We fit it.
Yes, we refuse it to say, no, I will not go to hospital. And it is only when the case becomes moribund that we start running. And most at times, doctors will tell the patient that, oh, if you had come earlier on, would have been able to.
Okay, let's take this call before I ask the other question. Hello, caller. Good afternoon. Please reduce the audio level on your television set. If your audio is too loud, we will not take that call, okay? We can't be repeating this week in, week out. Reduce the audio level. Hello, caller. Good afternoon. Hello? Hello? Okay, it's like that call is not coming through. Okay, the next question I want to ask now is this. At what point does constipation, because when you're constipated, you cannot move your bowels freely. At what point does it become toxin to the body? And when it becomes toxin to the body, what happens?
Yes, the stool, which is the waste matter, will become poisonous if it stays longer in the body. It becomes toxic to the human cell, tissue, organ, and the system in general. Therefore, the waste matter, which is the stool, must be evacuated after 72 to 96 hours, the case may be. Because we have said earlier on that the maximum time that the partially digested food will have to stay in the large intestine is 36 hours to 48 hours. At that point in time now, the colon has finished absorbing the water. So the stool now, which is now the complete digested food, you know, the waste.
Okay, Dr. Jolly, you will answer that question again at the point it becomes toxin. Hello, caller, good afternoon. Hello, I can hear you.
Okay.
Good afternoon. Please tell us your name, where you're calling from, and most importantly, reduce the audio level on your TV set. Biko, come out the volume.
Okay. Can you hear me now?
Yes, I can hear you.
Okay. I'm from Etete in Benin City.
Okay, what's the name, please?
The name is Obaze.
Okay. Go ahead with your question, Obaze.
Yeah. Now, when stooling, and the stooling becomes very hard, and you have to press before you now excrete. What really is the cause of that, and what is the remedy?
Okay. We got a question.
Yes.
All right, Obaze, listen up now.
One is not supposed to strain much when you are about to stool. But I tell you that some persons have this kind of poor bowel habits. The best time for you to answer the call of nature is when you have that defecation reflex.
Okay.
You just feel like, you know, there's a change in your body chemistry that you want to defecate. But a situation whereby you not suppress it with the higher center, maybe you are busy at that time. Physiologically, you are even causing constipation to yourself.
So and when the urge comes, you just
exactly. That is another way to avert or to prevent constipation. But some persons, they just try to, maybe you are in a long distance traveling vehicle, or maybe you are in a busy place, and you feel that there's no convenient place to do it. And when you continually do this over time, you are practicing physiological constipation, and your system will change, and before you know it, you start suffering constipation. And not only that, there is what we refer to as the mass movement. What it means is that when you eat food that contains fiber in the morning, maybe you eat food containing vegetable, or you take a lot of water in the morning, it brings about what we call the gastrocolic and duodenocolic reflex. What it means is that there is a push down of not digested food from the stomach downwards to the digested food. That's what we call gastrocolic and duodenocolic reflex. That will help to promote the urge for defecation reflex. That is why it is not a problem that in the morning, for example, when the mother is trying to breastfeed or spoon feed the baby defecates. It's a good defecation reflex. Because the newly food that is space. Yes, the food that you are introducing now will further push down the already existing food there. That is a good reflex. And not only that, there is also what we refer to as there is also a bad toilet habit. You see some persons, because of the modernization, there are special toilet standards, not sitters now. I tell you that with the natural positioning of the colon, you will see that if you look at very unfortunately, we don't really have the picture to show to the viewers. If you look at the last part now, which is the anus, there's an agonity of the anus with the colon. That is, this agonity will further be promoted when the person is sitting down or you are squatting.
So there's a special position.
You have to stay. You must attain. You must exactly before you can be able to push out stool without straining.
So is modernization causing a problem in all of this?
You see, you see the way they now produce some toilet sitters. Some of them it has to bend your body to
combos now.
Exactly. It turns you in such a way that you are no more there's no more. You are not that agonite. Yes, yeah, exactly. The best way one can defecate freely without straining is to squat. Yes, but you see that some modernized toilet sitters now, it tends to do as if maybe you are lying down or supine, as the case may be. That might, you know, straighten that. Yes, yes, because the angulation, you know, it's only when the angulation is in proper 90 degree, that is when the stool can fully come out without straining. But some persons, they stand, some people bend, or even kind of sit on top of the...
So the kind of combos we have now, you know, create problem for somebody to like have a good bowel movement. So squatting is the best
position to stool freely without straining.
Let's take this call. Hello, caller. Good afternoon. Please tell us your name and ask your question. Thank you.
Osama.
Okay, you're welcome.
Calling from Benin City Airport Road.
Okay, happy to have you on the program.
I want to find out from doctor if late consumption of supper has a relationship with constipation.
Okay, when you eat late, if it has anything to do with constipation. Okay, thank you. So eating late and constipation, what's the relationship?
Yes, when you eat late at night, there is usually a shunting. This is the explanation proper. We advise that you eat like a king in the morning. You eat like a prince in the afternoon, and you eat like a servant at night. Because at night, your brain will function more. Because of that, blood will be required more in your brain area to regulate your sleep. So by the time you eat late at night, except maybe you are going to do some work, but that might not be possible. You eat late at night, you see yourself jumping down to your bed. So in that case, you discover that your musculoskeletal system will be inactivated. There's no action.
At that point, no action.
No action. So digestion will be slower. So such person might be prone to what we call the slow transition constipation. Because at that point, the blood supply to the GI, to the gastrointestinal tract, will be very low. But when you eat maybe in the evening, and it's still possible for you to still move around, as the case may be, you might not suffer constipation. I will say to that caller that, yes, if you ate late at night, you are going to have constipation. But it's the explanation that I've just made that person to be aware about.
Okay. All right, 052-290573 is the number, and we are talking about constipation. We're doing constipation. If you have any question, ask. Okay, so doctor is going to leave in a couple of minutes. Ask any question you want to ask, and then when we are done, you will be happy that you ask questions. 052-290573 is the number. Quickly ask questions and let's know what to do for you. Okay, time is running out. What can we do? Okay, let's look at the issue of fruits. That's talking about treatment of managing and treating constipation. Now, somebody's asking this question: is fruits like orange and other citrus not helpful when somebody is suffering from constipation? So let's quickly do this and do treatment and management now in the next 5 minutes.
Yes, in simple constipation, the best way to go is to encourage simple constipation. Yes, simple constipation. That constipation.
How would I know that I'm suffering from simple constipation?
In simple constipation, it means that the problem occurs as a result of inadequate intake of fiber and fluid. That's water. That's simple constipation. Simple constipation. Yes. But in idiopathic severe constipation, it means that the person has an underlying condition. Yes, it could be structural problem within the gastrointestinal tract. It could be motility problem. It could also be an inoretal condition that I've explained. And it could also be as a result of other medical condition. For example, somebody that has neurological problem like cerebrovascular accident or stroke, spinal cord injury, multiple sclerosis, such person are most likely, even Parkinson's disease, they're most likely going to come down with constipation. Not only that, people that have metabolic condition, like diabetes, hypercalcemia, hypothyroidism, they are most likely going to come down with it. So those persons who have this underlying medical condition, they must have constipation, as the case may be. Not only that, constipation also occur in people that are not mobile, like in elderly, who stay sedentary, exactly. They suffer constipation. Even we have also seen constipation occurring in people that suffer depression, whether it's hormonal influence, you know, as the case may be. So, like, as I was explaining the importance of fruits and vegetables, if one's constipation is as a result of just inadequate fiber or fluid intake, yes. If you take orange, take pineapple, take watermelon, and you increase your vegetable, your food, you will suffer no constipation anymore. Yes, and you take water, with or without food. When you wake up in the morning, take, you know, enough water. You know, that helps to, you know, increase your GIT. Increase your GIT motility, and, you know, the constipation will be solved by. So, if only it's as a result of inadequate fluid intake, but you can see that for constipation that is as a result of other medical condition, like as I spoke about neurological causes, I spoke about metabolic causes, I spoke about depression patient, as the case may be. Treating those conditions will also help to relieve the symptom of those constipation. So you can see that the constipation becomes a secondary problem to that primary, you know, medical condition. So seeing a doctor and proper evaluation, we can be able to know what exactly is causing the constipation.
Okay, time, of course, is fast spent, and now we're about to round off now. I know that a lot of persons are trying to call, but the lines are jammed at the moment. What you do for me is to call this number immediately after this program, okay? When you call this number, we'll be able to respond to you. So you call 080-3472-1750, 080-3472-1750. Please call this number because you'll be glad you did. So, doctor, as we call it a wrap now, what is your advice in just 30 seconds? What's your advice to the general public now?
Yes, medically we have found out that simple constipation is the
commonest of
cause of, yes. So there's a need for everyone to increase their fluid intake, increase your fiber intake. That is to say that you consume more vegetable, take fruit of your choice, and when you do this, you will not strain and you will not have difficulty in passing us stool.
Okay. All right, guys, this is all we're going to do today. Please call that number so that we'll be able to respond to you and answer all of your questions. And after that, we'll be able to do other things. So call 080-3472-1750. That's the number, and that's all we're going to do today. Thank you for your calls. Thank you for watching. We'll see you again on Monday. Bye-bye.